Hello friends, welcome back to my YouTube channel. So in today's video, we are going to discuss yet another important toxicology topic, that is organic irritants in snakes. So it is a very important essay question for forensic exam. Let's see that in detail. So the toxicology in snake is going to be discussed under 8 topics, that is classification, that is into poisonous and non-poisonous snakes, and then the family, that is Ellapidae, Viperidae and Hydrophiinae, and then features and fatal dose, signs and symptoms, diagnosis, management, postmortem findings and medicolegal findings. So first let us see about the classification of snakes. So the snakes are classified into venomous and non-venomous. Generally we don't call it poisonous and non-poisonous snake because poison is either consumed, inhaled or absorbed through skin, whereas venom is the one which is injected via stings and bite. So this is based on snake bite, so you should call it venomous and non-venomous. So in venomous snake, it is divided into 3 types, that is Ellapidae, Viperidae and Hydrophiinae. So in Ellapidae, it is cobras and allies. Viperidae consists of vipers and Hydrophiinae consists of sea snakes. In Ellapidae, the examples are king cobra, cobra and krait. In Viperidae, it is Russell's viper, pit viper and saw-scaled viper. In non-venomous snake, it is rat snake and vine snake. So next let us see the features of venomous and non-venomous snake. So the common venomous snakes present in India, those are only 4 common species, that is common cobra, common krait, Russell's viper and saw-scaled viper. Next let us see about the head scales. So in venomous snake, the head scale is going to be small, and in non-venomous snake, it is going to be large scales. Here the small head scales, that is except for cobra and krait. Next let us see the belly scales. In venomous snake, the belly scales are going to be large scales covering the entire belly, whereas in non-venomous snake, it is going to be small scales, so obviously it will not cover the entire belly, and it will be either it will be small belly scales or moderate belly scales. It will not cover the whole belly. Next let us see the fangs. Fangs are basically bite marks of these snakes that which it leaves on the victim. So it is going to be 2 large fangs marks in venomous snake, whereas multiple fang marks in non-venomous snake. And this venomous snake generally bites during the night, so it is nocturnal, and non-venomous snake, it is going to bite during the daytime, so it is daytime snake. Next is tail. So the tail in venomous snake is going to be compressed, and in non-venomous snake, it is going to be non-compressed. So next let us see the 3 families of the snake, that is Hydrophiinae, Viperidae and Ellapidae. We are going to see its clinical feature and fatal dose. First let us see 3 points that are common in all 3 families, and then let us see the individual clinical features and fatal dose. So first thing is poison apparatus. Poison apparatus is a place where the poison is going to be stored, or the venom is going to be stored in the snake. It is nothing but modified salivary gland consisting of gland, duct and fangs. Next is a snake venom, the poisonous thing which is going to be injected into the victim. So it is nothing but the saliva of the snake ejected from the poison apparatus during the act of biting. It may be neurotoxic, vasculotoxic and or myotoxic. Next is the local signs and symptoms that the patient is going to have. So it is basically fang marks or the bite marks, bleeding, bruising, lymphadenopathy, lymph node enlargement, abscess formation, blistering and necrosis. So next let us see the clinical features and fatal dose for each of the types. So I have made it into a tabular column so that it will be easy for you guys to compare and study. So first let us see about Hydrophiinae. So it is going to have musculotoxic venom effect. It is going to secrete musculotoxic venom, which is going to have musculotoxic effect on the victim. So it is the site of bite is going to be painless and have minimal local swelling, generalized rhabdomyolysis, muscular weakness, tenderness on active movement. Next, myoglobinuria seen after 3 hours of snake bite, renal failure, hyperkalemia, cardiac arrest and death. Next, let us see about Viperidae. So the Viperidae is going to have vasculotoxic venom. So you can remember it as V and V. So it is going to have vascular effect on the victim. This generally presents with bleeding and hemorrhage from all the sides of the body. So that is what the clinical feature is: bleeding, spontaneous bleeding from all the parts of body. It is caused by viper. The patient presents with conjunctival edema and subconjunctival hemorrhage, epistaxis, gum bleeding, hematemesis, fundal hemorrhage, bleeding from the bite site, etc. There is going to be acute renal failure, DIC, that is disseminated intravascular coagulation, circulatory shock and oligouria. Death is due to circulatory failure because the patient is going to lose a huge amount of blood. And then the fatal dose differs for each of the snake. That is, for Russell viper it is 40 mg, and for saw-scaled viper it is 8 mg. Next, the fatal period is 1 to 4 days. So next, let us see about the important family, that is Ellapidae. So this Ellapidae, it consists of two main snakes, that is cobra and krait. So we are going to discuss the features of cobra and krait separately. This Ellapidae, it is generally going to have neurotoxic venom and it is going to have neurotoxic symptoms in the patient. So first let us see about cobra. Cobra bite, the patient presents with burning and tenderness, local necrosis that causes wet gangrene. Early symptoms are like vomiting, heaviness of eyelid, hyperesthesia around the mouth, dissing, hypercongestion of the cornea. Next is muscle weakness that leads to respiratory failure, cyanosis, altered sensorium, coma. Drooping of head, ptosis, which is typical CNS complaint. So this is about cobra. Next, let us see for krait. In krait bite, the patient is going to present with abdominal pain, CNS symptoms present, but there is no nausea or vomiting. This is the differential feature for cobra bite and krait bite. So in krait bite, the patient does not present with nausea or vomiting, but the drowsiness is like several times higher than the cobra bite. So the fatal dose for king cobra is 12 mg of venom, and for common krait it is 5 to 6 mg of venom, and fatal period is 12 to 24 hours. So next, let us see about the diagnosis. There is an important diagnosis, that is 20-minute whole blood clotting test, which is also called 20-WBCT. So what we generally do is that place few ml of freshly sampled patient blood, leave it undisturbed in room temperature for 20 minutes and generally invert the tube. If the blood does not clot, then it might have like vascular pathology that is present in Viperidae bite. So it is commonly done for all snake bites. So next, let us see about the management. Any patient with history of snake bite should be observed for 8 to 12 hours. First thing is primum non nocere, which means first do no harm. Like generally in village areas and rural areas, people do mouth sucking, putting incision and making it to bleed and such things that should not be done. Next, we have to prevent the spread of venom. So for this we have to reassure the patient. And next is immobilization, because moving the limb, either it is hand or legs, will cause more systemic absorption of the venom. So you should immobilize the limb. Next, pressure immobilization, wherein we tie a tight gauze around the limb so that it limits the systemic absorption, but it should not be tied very tightly, because if it will be tied very tightly, it will lead to excessive tightness and loss of blood supply and gangrene and all that, gangrene necrosis and all that. So it should not be tied very tightly, but it should be tied in the way it causes pressure to the limb. Next is anti-venom treatment. So in that, generally in India, pentavalent anti-snake venom is available in India, which is effective against common snakes in India. So we already said that there are 4 common poisonous snake present in India. So this pentavalent anti-snake venom is going to be effective against all the 4 types. So the dosage is 8 to 10 vials administered slowly via IV route for a period of 1 hour. Next, let us see the postmortem findings. So if the patient dies, the postmortem findings are going to be like, in venomous snake we said there is going to be 2 fang marks, whereas in non-venomous snakes there will be like several bite marks. That is slightly so in venomous snake there is going to be 2 fang marks that is slightly separated from each other, whereas in non-venomous snake it is going to be semicircular teeth, and in vipers the patient is going to present with discoloration, hemorrhage and necrosis. Next, let us come to the final part, that is medico-legal aspect. Any patient with symptoms should be admitted within 24 hours. It is usually accidental and it is also an occupational hazard, because farmers working in a field and all will be commonly being bitten with snakes. So it is an occupational hazard, and occasionally it is going to be used for murder and suicide. So with this I end today's video. Thank you so much for watching. If you found this helpful, do subscribe to the channel for more such videos. Also like and share it to your friends for more such content. Thank you.